Hello everyone, and welcome back to my channel. So my room is a mess. We're not going to really talk about that, but today's video is going to be about my first week in my emergency medicine rotation, which is my first rotation of PA school. It's in a small rural hospital, and I will never mention the name because just for HIPAA compliance and to protect patients and providers in my school, all that. But it is in California, and it's a small hospital. We have like a 42-bed emergency department, and it's in a rural area, so I see interesting patients. But now I'm going to cut over to me on my first day of my first ever rotation and kind of how I'm feeling. This video will be just my first week, which is only 3 night shifts, and then I have 3 days off. And I'll kind of just walk you through how it's going, kind of be my updates every day. And then at the end of this rotation, I'll do another video that's gonna more explain like my overall feelings of this rotation, the things I got to do, and if I can see myself working in emergency medicine in the end. But without further ado, here is my first week in emergency medicine as a first rotation PA student, fresh out of school, first time seeing real patients in a crazy setting I've never been involved in. So I hope you enjoy. Also, real quick, don't forget that you can follow me on my Instagram at WhiteCoatChasing. I'm going to post more content there, more stories of kind of my day-to-day actions in each rotation. And then I also will, answer DMs or any questions anybody has. And I periodically do like Q&A sessions and stuff. So I try to help with pre-PA stuff there. Also, I will be doing videos like these for each of my rotations, so be sure to subscribe to see those future videos. All right, and now without further ado, here is my first week in emergency medicine. Good morning, everybody. It is officially the first day of my rotation. I do not start until late tonight, so I'm up right now. It's 8. We had the time change yesterday, so technically in my mind it's 9, and I usually wake up at 7:30, so I slept in a little bit. I'll probably take like a nap later. I gotta get a couple things done before then, before I end up driving up there because it's an hour-ish drive. So I'm gonna get a couple things done, probably take a nap, and then my orientation's at 5 and my shift starts at 6 right after. So it's gonna be a crazy day today. I feel like in the past when I thought about my first day of rotations, I would be super nervous. I'm not saying I'm not nervous, but I feel like we've spent the last month really talking about what to expect and kind of like you don't need to know everything, you just need to try hard and be proactive about things. And I think this past we had a transition week that they had preceptors come and talk to us and just really broke down what to expect in your rotations. And I think after that eased my nerves. I'm not too nervous. I mean, obviously I think the procedures suturing lacerations and those types of things that I've never ever done before, I think that's what makes me most nervous. But after talking to preceptors, I realized that even if your differentials that you give the diagnoses, if they're wrong, as long as you try and explain them, that's fine. They just want to see your thought process. So after kind of hearing that, I feel less nervous about that part. But I mean, I'm excited for the procedures, but I think that's the part that makes me the most nervous, since that's just the only time I've ever sutured was on my little jelly pad thing that we have. So I'm excited to do that. I'm excited to start those types of patient experiences and skills. But I think the first couple times will probably be a little nerve-wracking. All right, I'm gonna try to rest a little bit more before I have to run some errands and get stuff for lunches, and I'm gonna get donuts for the first day. And then I'm gonna probably try to nap, and then I have to leave here about 3-ish. I'll probably be pretty early if I leave around 3-ish, but it's my first day and I don't want to mess anything up. And I obviously have never been through the security process at this specific hospital, so I want to try to get through that early. So at least know, have an idea of how long it takes for the next few shifts, and then, yeah. All right, now it's time to do some shopping for some food.
This place is amazing. I love.
All right, donuts have now been acquired. Now it's time to go home, and I am going to shower and then try to take a nap before I have to get ready. Hello, friends. I have shopped, donuts have been acquired, I have showered, dried my hair, put it in this little thing because I don't want to put in too much effort to make it look like I'm trying hard, but want it to look decent, and it takes 3 seconds, and this kind of curls my hair. I'm going to try to take a nap, and then I'm going to get up, get ready, and then I already packed my lunch, so that's ready to go, and then change, get my little white coat in my car, and make sure I have all my fun goodies that I'm going to need for today, and then I'm going to make that hour to an hour and a half drive, and I'm leaving quite early so that I mean, I know the drive, I've done it before, so I know where to go, but traffic is always different every day, and that area that I'm driving through, there's a lot of accidents, a lot of craziness, you know, in that area, so I'm going to try to leave early so I don't make a bad first impression. But I am going to try to nap a little bit, or at least rest, and then I'll be on my way. All right, friends, we are scrubbed up, white coats in the back, ready to go. My boyfriend surprised me and came and said hello and got me some coffee. Donuts in the front seat, backpack check, notebook check. Now we are off to our drive, and hopefully there's not too much traffic. Definitely scared, definitely nervous, definitely don't know what to expect, but wishing for the best and gonna go in it with an open mind. I for sure didn't get to nap as much as I would have liked, so I am a little tired, which obviously is not a good thing for not only your first shift, but just shifts in general, but that's okay. We're gonna ride with it. I feel like once I stay up past a certain point, I am like awake and can't fall asleep anyways, so I'm hoping I get to the point and push past it. I have a Celsius, I have that coffee, so we are just going to hope for the best. I'm gonna get some gas. Sorry, I know you can hear probably that annoying blinking, but I'm gonna get some gas, and then I'm gonna be on my way. All right, guys, I am here. I am significantly early. I got here at like 4:15, and my preceptor actually wouldn't even be here until 5:15. It was supposed to be 5, but there's some traffic. So I'm just hanging out in my car for another 5 minutes. I still plan on walking in early because you have to do like the temperature check and everything, and I want to be there when he gets here. So there's that. I went to the Starbucks to use the bathroom because after all the coffee I had and after the drive, I was like, all right, I want to go in with a clear mind and not thinking about peeing my pants. I got my masks. We have the N95. This is the one that I got mask fit tested with. It's really snug on there. I have my backpack with all of my medical goodies, you know, all that. Got my lunch bag ready. So I'm going to sit here for like 5 minutes, collect my thoughts, take some deep breaths, and then I'm going to head in. Wish me luck. All right, everyone. It is now 5:15-ish in the morning. I just got back from my first shift. I'm taking my makeup off and I'm trying to get to bed as fast as possible. I'm pretty tired. It was a really, really hectic shift. It's a small emergency department, but they have a very large patient load because it's one of the few EDs in the area, so they see quite a bit. So I only saw 3 patients, you know, like history, physical by myself, missed a bunch of things, didn't know a lot of the answers to all the questions that I got, which I was like completely expecting, so I, you know, just know what to work on next time, what kind of questions to ask. Saw full code, saw, what did I see? A lot of chest pain things, a lot of kind of viruses, kids with viruses, pneumonia. We don't see COVID patients. I saw them like through like the triage window and like got to hear their stories and whatnot, but we as students don't see COVID patients, and I'm thankful for that. Yeah, I certainly look a mess right now, but it was a long shift indeed. This one was like basically 12 hours because I got there early and kind of started early, and then we ended a little bit late. So that was my first time doing a shift that long, and first time working in a very, very fast-paced environment, and it's really overwhelming, especially when they're like triaging people and just kind of getting people in and out super fast. That's something I'm not used to, and I don't know if I'll get used to it in the time that I'm in there, but definitely a lot of room for improvement. But it's literally my first day, my first rotation. The other student that I was with, it was her last rotation, So of course things are gonna look different from your first and last rotation. So I can't be like too disappointed at where I'm at yet, because literally I saw my first 3 real patients today, and I have many, many more to see. So, but anyways, I am going to try to get some sleep because I am getting very, very tired, which is awful to say because it's 5 in the morning, but that's okay. I have 2 more days and then I have 3 days off, so I'm gonna just keep pushing. Hello guys, it is, what time is it? 2? I think it's 2 p.m. Woke up, kind of just relaxed, ate a little, talked to my mom. I logged some patients, and then I took a shower, got ready. I have to leave a little bit. I get to leave a little bit later today since I don't have orientation. So yesterday I kind of spent like 12 hours there, and hopefully today will be more 10 to 11 since I don't have that hour of orientation. So hopefully it doesn't feel as long of a shift and I prepare better and bring an energy drink, because I hit a slump around like midnight, I would say. So I'm hoping to maybe drink or take some caffeine at that point, because I still have 4 hours, so it's not too late in the night. I don't feel like to take any sort of caffeine, but I definitely feel like I needed it. So for future shifts, I will prepare for that. But tonight is my second night of 3 nights in the night shift, and then tomorrow will be my last, obviously, and then I'll have 3 days off, and then I'll have actually 3 day shifts. So that's the only time I have day shifts, so I'm working majority nights, which is okay. Like I said, I worked nights before as a CNA, but it is a bit different now that I have like an hour drive to and from, so it kind of adds a little bit. But tonight is 2 of 3, said I should see more patients on my own since I only saw like 3, 4 on my own yesterday. And then hopefully today will be more procedures. So it'll be an interesting shift. Hello there. So I just got to the hospital. It's 5:20. I got here way early. I'm supposed to be here at 6. Obviously I go in early to be a good student, but I'm here pretty early to where I have some like extra time to just relax, which is kind of nice. Gonna finish my coffee. I got like the super high milligram coffee, so I'll stay awake, and I brought a Celsius, so hopefully I won't be so tired. But hopefully we get to do more procedures. Yesterday wasn't really a procedure heavy day, which I was fine with. It was nice to be able to take histories and stuff. I still have a lot I need to look up, and I didn't do much after I woke up today. I was really tired, and I'm kind of giving myself a little bit of grace. I listened to some podcasts on things, but I didn't do too much. I logged my patients and kind of just rested. But today maybe we'll see more procedures. We'll see. As I was driving and I saw like an ambulance, and I was like, oh, I wonder what's going on. It's kind of fun to be on the side of where I get to see what's going on. I've always been a curious person and love to when I drive and I see an ambulance, I always want to know what's going on, and now I kind of get to. And yesterday I think the biggest thing that was crazy to me is the person came in from the ambulance, and like I was the first person to really see them. I mean, obviously they like checked in and like the nurses did vitals and whatnot, but like I was the first person to ask kind of what was going on and examine their foot inside the hospital. At least obviously EMS gets there first, but it's just kind of cool that like I was the first one. And it is weird because only one of the other doctors and the students wear white coats, and so obviously patients associate white coats with like providers, and obviously I'm not saying I'm on providers level at all, very far from it, but patients really do respect the person in the white coat. And I feel like some of my questions that I asked, it was because I was nervous and they were kind of just rambling, and they weren't really far off, but they weren't exactly the questions I should have been asking. But to them, like, they just thought I was asking questions that were important in my mind. So it's kind of nice knowing like probably only the provider knew I didn't need to be asking those questions. Not that they were harmful to ask, but probably just more in depth than I needed to go for certain things. But it was really cool to wear a white coat and ask these questions and do all of that. It felt, not that I feel like I don't know how to word it, not that I feel like I deserve respect. I do not, not the same as a provider in any sense, but it was really cool to get that kind of respect from patients, because I've never seen that before, since this was my first time with a patient, in a real setting. So that was really cool to witness. But I'm gonna go relax just for a little bit, just staying here in my warm car, and then I'm going to head in a few minutes early. Okay, now we're back. I just got home. So tonight was 3 to 3, so I have 3 off, which is really nice. And tonight's shift went a lot better. It went by pretty fast. I saw many more patients on my own. So when patients come in first, they do like the triage. So the provider will ask them like a bunch of questions and then bring them back and examine them. And then they'll do whatever labs and stuff that they have to do. So the first 2 days, I didn't do like any of those patients. I only saw like patients that came in later or like from ambulances or something like that. So today I was actually up there in like triage, like with all the nurses there that were intaking them and like asking them what was going on and all of that. So that was really cool to help run that. And then we just kind of monitored those patients that we helped intake. There was a lot of COVID stuff, and we're not allowed to go to any like respiratory things. They have like an isolation room, and students are like not allowed in there, which I'm really thankful for. So I didn't go in there. So a lot of our patients were COVID related. So every time he went to like check up on them, I couldn't go with him. So I just have to ask him when he came back. So there's a few positives of COVID, and then probably just other viruses that came back negative for COVID. But I did I did a rectal exam my first night, and I got to do another rectal exam tonight. And then I was just checking for blood for both of those. And then tonight I was able to do a paronychia, which is like around the fingernail was swollen. So I just did a little incision there and helped drain that. And then what was really cool is I got to do an abscess, and it was about, it was a pretty big abscess. So I got to cut it open, drain it, pack it. First I did obviously lidocaine and all that stuff. So numbed it up, cut it, drained it, packed it, and then put a dressing on it. And then, told her the discharge like protocols of when she should come back and get it, changed all of that. So that was pretty cool. And that was at the end of my shift. So I was a little sleepy, but it went pretty well. I guess I've said students before have like nicked themselves with a scalpel or accidentally poked themselves when they were doing lidocaine. And luckily I didn't do any of that. Despite my minimal experience with needles and, I'm really blanking, blades and all of that. So it went well. No needle sticks report, nothing went bad. He said I wasn't timid, I just got in there and did it. So that was pretty cool. But yeah, I saw an active, pretty bad GI bleed be intubated. And the doctor that was running the intubation actually asked me a couple questions afterwards about like hemoglobin and transferring like blood and fresh frozen plasma and stuff like that for clotting factors. And like I got the questions that he asked me correct, so that felt really good to get that right. So that was pretty cool. We saw a code stroke. That was interesting. Saw a few things tonight that were pretty cool. Glad I got to see more of my patients. A lot less RSV tonight. Some fun things to help work up, like there's a domestic violence that came in, so it was assault. So some pretty interesting things. I feel a bit better about everything, but I'm still tired, so I'm going to go inside and sleep, and I'll probably kind of do a recap of my first 3 days tomorrow when I'm more bright awake and not sitting in my dirty white coat in my car waiting to go inside and sleep. Hello from a very messy room of mine. I'm at my place down by my school, and like I said, I'm staying with my parents for this rotation. So I came back here just for a few days to kind of recollect my thoughts, do some laundry, kind of just get back into the groove of things. Those first 3 nights like weren't bad. Obviously you kind of saw how they went, but they took a lot out of me. So I needed a little bit of time to recoup. So I did that. I start again tomorrow for another 3, and it's 3 day shifts this time. So I will be preparing for that. So I was trying to get back on like a normal sleep schedule to be okay for my next 3 shifts. So I finished up doing laundry. It's about like 2:30. I'm probably gonna head over to my parents now. Going to have dinner with them and try to get some sleep. And then my shift starts tomorrow at 8, and then for Monday and Tuesday they start at 8 or 9:30 actually. So it's a little bit later, and I'm excited because since it's a day shift, this means that I'm going to be able to get Dutch Bros, which is a coffee shop, and I don't have one close to me here, but there's one there. So I'm pretty excited about that. My room is an absolute disaster. Closets open, dirty clothes spewing everywhere. But that's not going to get solved today because I have a lot of other things to do. I finished logging my patients for the last 3 days. So we have to do Rosh review, which is like questions, and you have to do a certain amount per like day or per week. And at the end of the rotation, we're supposed to have like 11% of those questions done. So I did those for this past week because I didn't do it during like the 3 days I had shifts. I just did more questions during my off days. And then I got to prepare my notebook for this next 3 shifts. Scrubs all clean, white coats all clean, shoes all clean. Yeah, so the night shifts, overall, it went a lot different than I thought it was going to, but also exactly how I thought it was going to. I knew in emergency that you kind of get thrown into it, and I kind of was thrown into it. It feels weird that they trust you. Like, I'll go listen to someone's heart and lungs, and they sound clear to me, but mind you, I've only listened to a very small number of heart and lungs. And they're like, okay, that's cool. You know, put him back to the lobby and we'll tell him when his x-ray is ready to go. And I'm like, you're not gonna double check yourself? Like, even if it's not a lung complaint, like, you're not just gonna listen just in case I screwed that up? So there's, obviously they don't trust you to do anything that would ever harm the patient if there's like a life risk type of thing they're seeing them, but you do get a lot more trust than I thought you would. I feel like it went better than I thought it would. I felt a little more comfortable than I thought it would, especially after the first day. But I still don't think ER is it for me. I really like the continuity of care. We had a patient that ultimately got admitted into the hospital, and she was sitting in the hallway waiting to be admitted but was in pain. But at that point, she was under the admitting physician and not my preceptor, so my preceptor couldn't order anything on her anymore. So I just had to watch her be in pain, and I couldn't see that continuity to like see where she was going to be admitted and how she was going to be. You don't find that out in emergency. Obviously, you take care of them, figure out if they're sick, not sick, and kind of shunt them to where they need to be. And I realized I kind of like the whole getting to follow up with them. Like in family medicine, if a patient came in and they had to go get a surgery, you would get the surgery report and you would see them a couple like days or weeks post-op, and you got to ask them about it. And I like that, and I like the patient education. Obviously, you do patient education in emergency, but it's a little bit different. I feel like family, med, you get like a lot of time to do that. Not a lot of time, but more than emergency med. And I feel like that's the kind of medicine that I like to practice. And it's not that it's better, it's just different. And I think everyone's personality kind of aligns differently with different types of medicine. And I don't think mine aligns with emergency medicine. But the best part of doing rotations is getting to know where you don't want to work. So obviously figuring out where you do want to work is really important, but it also lets you know what settings are not right for you and kind of helps you pick a job later on down the road. And I think I will probably not be applying to any emergency medicine type of jobs at all. I would say urgent care I'm interested to see, but for now I think I'm more of a family med, outpatient, slower, get to know people type of kind of gal versus a quick in and out, fix you as best as I can and then put you somewhere else type of person. But everyone's just different. But all right, that's kind of the summary, or that's kind of how my first 3 days went. I guess I'm gonna call it my first week because technically I had 3 days off. The past 3 days I really didn't do much. Like I said, I caught up with like charting patients and doing those Rosh review questions. But that's kind of how it went. I only had night shifts so far, so that was the first hour and a half was kind of helping with intake, you kind of collect like your patients for the night. You'd get up to like 14-ish patients, the provider would, and I helped with like triaging or getting like the initial history and like really basic physical, and then we would send them off to do labs, and then we'd see them again after they did labs and kind of give them the results and all of that. And then you would follow them throughout the night. So if you had some people that were waiting on labs or were waiting in like the lobby or whatever, you would just follow and check their labs periodically to see if they came back. And then once they came back, you decided what to do. And then you went to that patient and told them, if they needed to be admitted, if they were okay to be discharged, what we were sending them home with, that kind of stuff. So that's kind of how the flow was. And then intermittently after you do the triage stuff, you'll help see people who come in via the ambulance. So that's kind of how it went for night shift. It was a little bit different, I've heard, than how some other emergency departments are run. I don't know the difference. I've never worked in any other one, but that's just kind of how the one I am in is run. But yeah, that's kind of my first 3 days went. First day was saw a lot. It was a Monday, it was crazy. Second day was kind of hard to see more patients on my own. A lot of things I'm just forgetting, and a lot of things my preceptor told me to look up. And then the third day went better. I felt more comfortable, saw more patients on my own, did procedures. So I'm excited to see how the next 3 day shifts are gonna go. If there's anything specific that you want me to like address in any of these, this rotation video or like in future rotation videos, be sure to comment below and I'll answer those questions as best as I can, or we can do like a little Q&A thing. But I'm hoping to continue these. It's not gonna be a weekly thing, I could tell you that, that's too much. But I'll probably do like a week in each rotation and probably like a summary video for each rotation, just to kind of say like the things I did, the procedures I did, the patients I saw, and kind of overall if I can see myself working in that field, because it very well may change. The first week I may change it the last week, and I might love emergency medicine, we don't know. But so I'll try to do that for at least, for each of my rotations. But all right, I am going to move on things. I'm going to drive home, have dinner, and then get some rest before I start my 3 days of day shift tomorrow. And then I have 2 off, but I have a presentation to give during one of their like Zoom meetings. And then I have 3 nights, and then I have some days off for Thanksgiving, and then 3 more night shifts at the end of this month, and then that will wrap up November. But thank you so much for watching. I appreciate it. You can always contact me or ask any questions on my Instagram at whitecoatchasing, and don't forget to subscribe to see more of my future rotation videos.